How is bile duct stone surgery performed? Imagine a situation where a small stone blocks the flow of bile from your liver to your intestines, causing pain, digestion issues, or even infections. Removing these stones is essential to keep your liver healthy and prevent further complications. The way doctors do this depends on the size, number, and location of the stones, as well as your overall health. There are 3 main approaches: endoscopic, laparoscopic, and open surgery. The most common initial method is called endoscopic retrograde cholangiopancreatography, or ERCP. During ERCP, a flexible tube with a tiny camera is gently inserted through your mouth, down into your duodenum, which is the first part of your small intestine. Using the camera, the doctor locates the opening of the bile duct. A special dye is injected to make the bile ducts visible on X-ray images. Once the stones are identified, the doctor makes a small cut in the muscle at the opening of the bile duct, called a sphincterotomy. This allows the stones to be removed with tiny tools. ERCP is minimally invasive, meaning no large cuts are needed, and it often provides quick relief. If ERCP cannot be performed, or if it fails to remove all the stones, surgeons may opt for laparoscopic surgery. In this procedure, small cuts are made in your abdomen, and a camera along with surgical instruments are inserted through these openings. The surgeon carefully locates the bile duct and makes a small incision called a coldichotomy to open the duct. The stones are then carefully removed. This approach allows the surgeon to also remove the gallbladder if needed, during the same operation. Laparoscopic surgery is less invasive than traditional open surgery and usually results in a shorter recovery time. In more complex cases, such as when stones are very large, numerous, or if there is significant scarring or inflammation, open surgery might be necessary. During open surgery, a larger incision is made below your right ribs to access the liver and bile duct directly. The surgeon opens the bile duct, removes the stones, and then repairs the duct. Sometimes, a temporary drainage tube called a T-tube is placed to help bile drain and monitor healing. Although open surgery involves a longer recovery, it provides a more direct approach for difficult cases. In some situations, especially with recurrent stones or a dilated bile duct, surgeons may create a new connection between the bile duct and the intestine, such as a coldichoduodenostomy or a coldichoduodeноstomy. These procedures help improve bile flow and reduce the chance of stones forming again, but they are more complex and used selectively. Sometimes, during surgery or endoscopy, doctors use laser lithotripsy to break large stones into smaller pieces, making removal easier. If complete removal isn't immediately possible, a temporary stent may be placed to keep the bile duct open and allow bile to flow. Over time, stones may shrink or pass naturally, especially with stenting. From a liver health perspective, removing bile duct stones is vital because persistent blockage can cause bile to back up, leading to inflammation, infection, and even damage to the liver tissue. If the obstruction continues, it can result in serious conditions like biliary cirrhosis or bile duct cancer. The goal of surgery is to restore normal bile flow, reduce stress on the liver, and prevent these complications. In summary, doctors choose the least invasive method that suits your specific situation, starting with endoscopic techniques and moving to laparoscopic or open surgery if needed. The main aim is to safely and effectively clear the stones, protect your liver function, and improve your overall health. Always consult with a healthcare professional to determine the best approach for your individual case.